Hi, I'm Kerry. I'm the host of Best of Us Investors, and we're a tribe of, right now, have over 100,000 subscribers, and I would project by this time next year we'll probably have 1 million because we approach investing differently. We try to find opportunities where we can grow our wealth exponentially. I dedicate 10% of my portfolio to stocks that I believe that are going to grow exponentially. And I think I have found a category that is going to grow immensely. And it is about disorders, addictions. The problem we have in our country, we have a $500 billion a year problem as a result of 11 million people being addicted to opioids. We have a $600 billion problem with 107 million people being addicted to alcohol. And then we are on the verge of a problem that will probably escalate double these two problems, and that is as a result of the pandemic. We're a social society, and we've been quarantined and we've been held unsocial, and the suicide rates are going up rapidly, the depression rates are going rapidly, and there is a search for a cure because thus far, for the opioids, for the alcoholics, the success rate is about 5%, and that's got to change. And there is a belief, and I'm pursuing it, that psychedelic drugs, psychedelic therapy is the answer. So in that cause, I did an interview with a executive from one of the companies that is going to be a player in this field. It is Entheon Biomedical Corporation. I want to introduce you to Timothy Coe, their CEO.
Best of Us Investors presents Kerry Griegmeyer.
My conclusion is that you are a part of what may be the most disruptive and potentially growth industry in the next 10 years.
I would think so, yeah. We are trying to radically disrupt the way that psychiatry is approached right now. I think, we've had a lot of decades with regard to seeing how the traditional pharma story will play out with regard to things like depression and addiction. And I've got some personal anecdotes that can speak to that. But yeah, I think societally we've seen sort of what the attempts have been and what the capabilities are. And we wouldn't be having this discussion if everything that was currently available worked. If things worked perfectly and mental health wasn't an issue, then people wouldn't need psychedelics. But I think increasingly the demand for it based on the ineffectiveness of what's available now is really encouraging the research. And the research is keeping pace and proving that this is both safe and effective.
From what I understand, and correct me if I'm wrong, that your work is approaching to try to find an effective way to cure addiction.
You've got it, yeah.
And possibly even expanding into depression.
Yes, I think, a lot of those, definitions of convenience like depression, anxiety, obsessive compulsive disorder, and addiction, they all really stem from the same place. That sort of complex milieu of emotional and psychological issues that really need to be sort of worked on. So the foundation on which a person is established, if the foundation is strong, then the behaviors that come from that are likely to change also. And so, yeah, we're trying to find something that is targeted at addressing those internal issues, sort of helping to supercharge psychotherapy and get a person to really find out what makes themselves tick and get on a sort of stable footing so that they can live the rest of their lives.
Now, when the word addiction came up, I thought of the opioid addiction. And I looked it up, and it is a $500 billion a year problem.
Yep. No, absolutely.
That's a huge market. Okay. And
Yes,
so then I said, well, what is the cure rate currently? And am I right? It's 5%.
you got it. Yeah. And that's just, that's what's tracked. Some of those endpoints in terms of effectiveness are only tracked as 6 or 12 months. But our understanding is that if you don't work on that sort of that core issue set, that a person may remain abstinent for 6 months, but then, as is the story often with a lot of addicts, that recovery story is, takes place over a lifetime. And if you're not working on that core issue, the core issues, that often you will relapse and return to drug use. So yeah, 5% is possibly even optimistic interpretation of that number.
Then my study then went to other health crisis, and something I hadn't thought about. The words showed up: Corona 19, and the depression and the side effects of this may be even larger than the opioid addiction.
Yeah. Yeah. And that's going to be a bit of a delayed wave, I think. It's undeniable that, the very fabric that builds, the society is built upon and emotional stability are built upon. It requires ongoing interaction, a sense of meaning derived of friendships, social interactions, also work, and the meaning that sort of is derived from that. And right now, I think across the board, in the developed world, we're seeing some of these lockdown measures, and the sort of eroding of security result in a lot of time for people to ruminate, think about their prospects, their optimism, pessimism, but also, sort of question the security that they presumed would always be there in terms of their, ability and right to work. We've already seen in Vancouver, where I am, a huge uptick, and it's a complex issue, but we've seen a huge uptick in the number of overdose deaths that have taken place, since the beginning of the coronavirus pandemic. So month on month, we're seeing death numbers, 130, 180 people per month, pretty consistently. And I guess for color, I don't know the recent statistics, but our month-to-month losses for coronavirus were less than that. So if you look at one as being a public health crisis, I think the case can be made for opiate addiction and opiate-related deaths as being a comparable public health crisis. I think the depression, suicidality, and addiction rates as a result of coronavirus have been secretly brewing and bubbling to the surface. It's a scary thought about what the aggregate societal impact will be in the next years.
So I think between us, we have just established a huge market for a product. Okay.
Absolutely, yeah. There is already a pretty established market for drug addiction related services and products. There's already a pharmaceutical market, Suboxone, methadone for opioid, medication assisted therapies. But then already understood is a pretty high price paradigm set of services. Residential treatment centers can run anywhere from $5,000 to $30,000 per month. And as was the case with my brother, who I lost to opioid addiction, over the course of a lifetime, he was in anywhere between 6 to 8 or maybe even upwards of 10 different residential treatment centers, each costing anywhere from, like I said, in our case, somewhere from $10,000 to $30,000 per try. And because none of those attempts really got to the core of where his perceptions and behaviors originated from, he might do a spin cycle, dry out, and re-enter society still afflicted by, sort of the weight and baggage of just life that he carried with him. And so sadly, I lost my brother to drug addiction in March of 2019. And it was a case study. It was an observation of, the well-intentioned attempts. And I do mean that earnestly. There was some, probably 100 different mental health and health professionals over the course of 2 decades. And really acutely over the course of the last 3 years that their most earnest attempts, given the tools that were available to them, just didn't have the necessary effect, and he lost his life to an overdose. So, yeah, there is already an established population that is in dire need. There's already an established sort of market precedent in terms of what people are willing to pay. And, sort of coloring that with the efficacy rates of what's available, I do think that addiction is a massive underserviced market where we think, and we're beginning to see the data that the molecules that we're considering and the molecule in question is both safe and effective in eliciting, and of course we need to do more clinical research around it, but the base literature indicates that this is not only safe, but potentially very effective in treating people with addiction issues and helping them to dramatically recontextualize their beliefs and then from that lead new lives.
So with that, we know there is a need and a desire to cure this and a lack of any effective methods. Why do we believe that psychedelic, I don't want to say the word drug, psychedelic treatments, therapies,
yes. Yep.
will be the answer to this problem?
Well, that's a really good question. I think the most obvious answer is that science is beginning to prove that. One of our advisors, Matthew Johnson, who I believe appeared on that 60 Minutes piece observed, he's recently run a psilocybin-based study with regard to psilocybin used for the curtailing or the management of nicotine addiction. So the efficacy rates there were higher than I think anything that could be found using things like Zyban or patches or gum. And ultimately, sort of based on that premise of psychedelics creating these profound introspective experiences that really do lower certain barriers that are in place that, afflicted people might have that prevent them from exploring themselves. There is that huge transformational capacity of psychedelics so that a person can assess things like their motivations, where that urgency and that discomfort in life comes from. And so we're already seeing some preliminary information about psychedelics being useful for the curtailment of nicotine addiction. And then also in terms of its effectiveness in the use or in the treatment of depression. And so, our understanding is that a lot of these issues, like I said before, stem from that same place. Sometimes it characterizes different things. Sometimes it characterizes eating disorders, substance use disorder problems, deep depressions, obsessive compulsive disorders. Ultimately, all of these things do drive at this idea of creating that really profound monumental experience, but not doing so in just, it's not a magic bullet that can just be given to a person unguided. I think the whole thing around the psychedelic industry is that it is an entirely new paradigm where instead of just giving a drug to treat a symptom and reduce anxiety or reduce pain or something like that, it is a pretty holistic approach where there's a preparatory relationship building experience where the patient, to better be understood by the physician, but to also better understand themselves, they prepare for the psychedelic experience through various hours of psychotherapy and preparation. Then the experience takes place and all these profound realizations happen. I can speak to that from experience. You have all these insights that were otherwise walled off to you. But the importance there, after having those realizations and having built that context and intent, is to fold those realizations into a working model for living. And so it is an entirely new paradigm. One that really does try to drive at the core of what traditional therapies do, which is to stabilize a person, but also get to a point where they can start unearthing their own truths and their realities and reassessing attachments, relationships, memories, and how that affects them. So it is, it's a profoundly, it has a profound potential for effect in terms of getting to those core truths that other treatment modalities try to.
So we've established a need. We believe we have a solution. Where does Entheon Biomedical fit into this?
Yeah, absolutely. the need is obviously established. There is a appetite for it. And currently there are some means of people accessing these things in sort of gray market ways. It's a growing trend where people will fly to the Amazon to receive ayahuasca treatment, where ayahuasca is the sort of traditional brew that contains DMT, dimethyltryptamine, that we're investigating. But not everyone has those means to board a flight, and I think especially with coronavirus happening, it's not a totally accessible thing, nor is it an entirely medically supervised or scientifically backed type of experience. Ultimately, for us, because the populations that we're intending on serving are sometimes the people with the most reduced means, and with sometimes confounding physiological and health concerns, we need to ensure that what we're doing is done so in such a way that ultimately it can be approved for sale by the FDA, the EMA, and Health Canada, so that people in need with a true medical need can be assessed by their physicians. And the physicians, based on those stamps of approval, will have the security and assurance that what they're prescribing is both safe and effective. And if there's also an opportunity for us to access insurance copay, that would be amazing too, because we understand that, insurance copay is a very important feature of the sort of prescribable drug market. But in order to do that, we need to follow on that regulatory pathway that has been established for traditional pharma. And create our evidence of safety and efficacy in such an empirically undeniable way that these regulatory bodies have no choice but to view them objectively and grant approval. And so that's our charge in life, is to take this assumption, understand the need, but also conduct the science in such a way that it's to the form factor that regulators want, so that ultimately this can be a prescribable drug that physicians and patients understand is safe to use.
What I'm basically then looking at is a drug or a therapy, I like the word therapy better, that is going to need FDA approval. So I'm guessing your next step is to do clinical studies.
Precisely, yeah. We, there are a lot of components that are necessary to eventually get this into human use. We're not trying to create a recreational product. Ultimately, this is going to be for serious medical conditions that require sort of physician observation, assessment, and then prescription. So, yeah, precisely. We are investigating this from the perspective of entering this into a regulatory conversation. So in late 2021 here, we've got an agreement signed with a contract research organization in the Netherlands to conduct human trials for DMT. So that's going to be primarily a safety trial, but we're also screening for low-level efficacy in terms of smoking cessation. So that contract is already signed. They're a world-renowned group of researchers. They've been involved in countless medical approvals. And so they're going to be conducting a human trial to test the safety and efficacy of DMT. And so we also have a GMP drug supply based out of Canada with our partner Psygen. And there's a really important point of differentiation, because this is going to a regulatory conversation. The level of stringency and empiricism has to be very great, because ultimately this does need to be necessarily for the regulators something that is repeatable, data, empirically safe. And so, of course, we're approaching with that perspective.
So what kind of time frame does that involve to get the FDA approval? Yeah,
so there are a variety of regulatory conversations that need to take place upon submission for our phase 1 trial. We will concurrently be engaging the FDA and Health Canada to alert them to our ambitions. And then, it is a dialogue, right? It's a dialogue. So we have our trial planned in the Netherlands under the auspices of the European Medical Agency. But each regulatory domain has certain nuances that might code for different patient realities and patient population demographic realities that exist from differences between populations in the US and Europe. So we're engaging with the FDA and Health Canada concurrent to some of our submissions in anticipation for our European submission, and then speaking with them about how to structure future studies as we get into deeper efficacy studies about what they require from their demographic considerations and how to best structure to be fully in the form factor that each individual regulatory jurisdiction will require. So pretty quickly within the next year, engaging the FDA to set up for what the trial designs will be following our phase 1 in the Netherlands.
Okay. Any kind of time frame? When would you see, in your looking into your crystal ball, when do you have a product to market?
Yeah. Disclaiming that, of course, there are a whole bunch of variables that, COVID may dampen some of the sort of optimism of, full clinical rollouts and things like that, from patient recruitment and the appropriateness of, people interacting. We see this as being potentially very optimistically being a product within about 4 years. And that is, about the typical sort of drug discovery pipeline timeline. Of course, these things can't be done in haste. They need to be properly structured with the right data in mind. That data needs to be very clean and then processed and interpreted. And then arguments need to be made to regulators to present the sort of nature of the data. But we believe that, within about 4 or 5 years, there could be a DMT infusion drug product on the market from us. But along that pathway, we understand that, that is quite a long financing narrative, and as well as a corporate development narrative. There are tools and technologies that we're looking to acquire, and we recently acquired a group in the genetics space, so that there is a sort of a psychedelic renaissance happening, and there are people using psychedelics at present. Ultimately, our research aims are to determine what the appropriate psychedelics to use on these different populations are. And so we are, looking to populate as much data as we can across a spectrum of data points with regards to genetics, as well as other biomarkers I can't yet announce because we're in the final processes of sort of acquiring and partnering with them. But in the near term, we do see there being the possibility for us to create immediately useful diagnostic tools so that patients as well as physicians may better determine what the right course of action can be based on a personalized understanding of the individual patient's physiology as well as mental state. So, in the absence of DMT being a approved molecule, we do see other molecules are currently online, such as ketamine, for the treatment of depression. And we recently made an investment into and have a research LOI with a group out of America that is currently in the process of developing a host of ketamine clinics. And we're seeking to leverage some of our recent acquisitions and our soon to be announced research partnerships to begin taking learnings from an already accessible, quote unquote, sort of psychedelic treatment model so that we can sooner create revenue generating and research valuable tools in the near term in an already existing ketamine market.
Okay. Well, that's something I hadn't. Is that relative to your acquisition of Halogen Life Sciences?
Halogen Life Sciences, yeah.
Okay. So they are, explain to me a little bit more about what their function is.
Yeah, absolutely. So Halogen Life Sciences is utilizing PCR-based genetic testing. And so we understand that not every patient is identical to the next person. We all have physiological, genealogical differences that will result a number of things. Our eye color, our skin color, when our hair falls out. Sadly, mine is falling out earlier than I'd want. But there are a bunch of variances that can be inferred from things like genetics, as well as physiological biomarkers. So Halogen, the acquisition of Halogen is one of the legs in what is going to be a developing sort of data project under Entheon. Ultimately, we understand that different genetic variances between patients will ultimately dictate things like how quickly certain molecules are metabolized, or if there's a propensity for negative adverse reactions from taking a psychedelic. And, right now, I think in the world of psychedelic medicine, a lot of the patient pre-screening is based on verbal discourse. It's based on self-reported patient. We want to develop out a more empirical and, I guess, data-backed way of interpreting what some of the pitfalls or what some of the variances in a patient reaction may be. And so with genetics, we can see a number of things, propensity for schizophrenic sort of disorders, also propensity for how quickly a molecule like ketamine or how intensely a molecule like ketamine or a classic psychedelic will interact with a specific person based on a whole number of things, and like how they metabolize certain compounds. So that is one area where we think there will be some immediate penetration and applicability of our tests. But in that testing, we do see there being a huge value in aggregating data to see what patient variance is across a whole swath of people. And we intend on applying that not only to DMT and ketamine, but also getting a better understanding about other molecules and how generally mental health is shaped through genetics. And we have some really some exciting announcements to make elsewhere that will mirror that intent about creating something that's immediately useful, but very valuable from a data aggregation perspective. Then ultimately, of course, that will serve our internal developments, but may potentially result in the creation of tools that could be used for physicians to better prescribe of all the molecules available. Yeah.
So you're using genome sequencing and looking at my gene. I come in and I need a psychedelic, but you're going to look at my genes, compare them to millions and billions of other people's genes, and try to predict the result before it happens.
Something like that, yeah.
That's cool.
Yeah, we may not necessarily need to sort of catalog it against a backdrop of millions, but we do understand that the presence of certain sort of gene snippets can indicate that yes, a person is more likely or less likely to experience a good or a bad. And so, we want to start cataloging that and start comparing that against other data to start validating those ideas and ultimately get to a point where the level of precision around that, as well as tying it to other biometrics, can give us a pretty clear picture and at least give physicians a more informed starting position. So, they can make more personalized health choices. And I think there's an opportunity for us to infer just additional information about what constitutes mental health, not just with regard to the psychedelic experience, but I think it would be nice to have a little playbook to go based off of, saying, oh, that's why I feel like this a lot of the time, and that's where some of the dangers exist, and get a better understanding of just general mental health.
The other element that when I look at a company that I want to invest in that is a startup or in its infancy, is financing. I would think, because of the overwhelming need and the lack of effective therapies for these health crises, institutional investing will come your way, and as will governmental. Any input in that area?
Yeah, no, we've been, of course, discoursing and dialoguing with some institutional people. Absolutely. I do think there's an opportunity. I think there's a combined will to get some of these things developed from the governmental perspective. And so, we're absolutely interested in that. With regard to institutional, we've had some early discussions, but from our perspective, at this early stage of financing, just being nimble and sort of reactive and sort of proactive, we've not needed so much in terms of capital where, there's a balancing act there, right? We don't want to, request all of the money at once at a sort of low stock price and low valuation. We've, asked the market for the money that we've needed to date. And we want to do so in such a way that it sort of benefits our already existing shareholders, and we're not asking for big sums of money that will result in huge dilution events for our already existing shareholders.
Okay. This is fascinating. I feel like I'm on the ground floor of our. I'm in a rocket that's about to take off, because the need is so overwhelming, And I think it's just going to magnify. And then as the opportunity is so great. I looked your stock up. The ticker is ENTBF. And today you closed at 66 cents. Exponential growth opportunity. I use the word, it's a binary effect. Either it's a zero or it just explodes. Everything is there for this to be a phenomenal investment opportunity if you people get it right.
Yeah, and hopefully I've given some color as to all the various considerations we need to take to make sure that we get it right, because getting it right is absolutely the foundation that we built this on. We know that, passion alone, and there's no shortage of passion from me and from my team, but ultimately there is a regulatory pathway that we need to follow in order to get it right and have the right people think of it as right. So that has been our primary consideration from the get-go. And so, that's where we're pointed for sure.
As you look into the future, and if you're a betting man, are you going to be bought by Big Pharma or are you going to become Big Pharma?
That is a very tricky question. Ultimately, we're setting everything up in such a way that we are, we're planning as though we're taking this to full completion. All the clinical trial design and considerations there have to, exist whether you intend to be bought out or intend to continue to operate. That is the reality. You can't skimp and create a clinical trial that is, different. That being said, open to all suggestions and open to all offers, but we really do think that we're doing a potentially paradigm upsetting type of road of discovery here. So, without speaking disparagingly about Big Pharma, we do think we're taking a pretty dramatic approach, or dramatically different approach, still utilizing the regulatory framework that exists. So ultimately, I just want to see these products built and actually having the effect on the people that need it. So I'm just building this company with that in mind, about doing the necessary scientific steps so that we create the wealth of evidence and IP that's needed to create a product. And so even if I were to give an answer today, 6 months from now, a year from now, things could change.
Exactly. I understand. Well, Tim, as a future stockholder, because I'm going to buy, I want you to take it all the way. Okay. I think there will be better return for me if you 4 years from now are still CEO of the company and you've taken it the whole way. I like to own companies where I know the CEOs. And from your position, the passion that you have built into this because of your life experiences, I know that you'll give the best attention to my ownership in your company. So, fantastic. I enjoyed this, and I hope that we can visit again sometime in the future as you move down the line of creating this wonderful opportunity for people to get off of addiction. I mean, just from a do-good. I've known people who are addicted, and I for a long time thought it was a weakness. Yeah. It's not. It's not. If you fall down the wrong hole, sometimes you just can't get out.
Absolutely, yeah. I was just telling this story to someone the other day that it's, I think, we're talking about mental health more and more, and I think it's really easy for people to sort of pass moral judgment and say, well, that person's life came as a result of a lot of bad choices. But no, I think the reality is that, a lot of these, like my brother, for instance, there's nothing morally objectionable or from a choices perspective wrong that he did. At some point before all this stuff, he was just a wide-eyed teenage boy, and it doesn't take much. A series of chance occurrences for that person to arrive at a state where they might, come to be judged. And I think, we do need to realize that all the people that are in need of help are, they're human like us, and they're as much as anyone else, deserve a chance at making, deserve a chance at reclaiming their lives and, arriving at a place of happiness and fulfillment.
Yeah. Okay. Yeah. Thank you. You have a wonderful cause. Hope it comes to fruition. Okay. There you have it. I think it is a booming, emerging industry that you need to be aware of. You need to go to Entheon's website. You need to educate yourself on it. You need to go to Seeking Alpha's page that breaks down their company, and you're going to find there is nothing there because they're an infant. They're just being born, and you have an opportunity. The stock closed on Friday at 66 cents. If they get this right, this will be a $600 stock in 4 years. If they get it wrong, it'll be zero. So what I'm suggesting is you make a decision. You do your research. I've done mine. I will buy Entheon because I'm willing to invest 66 cents in the fact that maybe, just maybe, I'm tying myself to a rocket. Somebody is going to be a huge winner in this area because, as I discussed with Tim, the need is enormous. The existing available cure is non-existent. And if, in fact, these kind of psychological cures, psychedelic drugs can cure this, it's a game changer. So if you like this video, if this is what you want more of, you know how to do it. You also need to subscribe. You need to come to Best of Us Investors. And there we'll discuss this further. We'll get deeper into the whole industry and where the opportunities are, and that's at Best of Us Investors. You'll go there, you'll get a link to our Discord. There's about 12,000 people waiting for you there to get your opinion and to share their opinion with you. And then also into our premium channel, you'll see exactly how many shares of Entheon I buy, and you'll be able to follow if there's any other companies that I buy so that you can keep up with exponential growth opportunities.